It's 3 a.m. and you're awake. Again. Not because of a noise, not because of a bad dream. Because your bladder decided it was time. If you're over 60 and getting up 2, 3, even 4 times a night to use the bathroom, I want you to know 2 things. First, you are not alone. Urology guidelines note that nighttime urination affects roughly half of adults over 65, and it increases with age. Second, the official medical guidelines list several no-pill steps that help, and almost nobody explains them in plain language. And this matters more than annoying. Urologists' own guidance calls nighttime urination a condition that impairs quality of life. And fall prevention experts at the National Institute on Aging specifically warn about one dangerous moment: getting up in the dark at night. A dark room, a sleepy brain, a hurried walk to the toilet. That is exactly how hips get broken. So today, no opinions, no miracle cures. I'm going to walk you through what the official urology guidelines actually recommend, step by step in plain English. First, let me introduce myself. My name is Mitsu. I'm a registered nurse licensed in Japan, the country where people live longer than almost anywhere else on Earth. For more than a decade, I've cared for patients in hospitals and in elder care, including many nights helping people exactly like you get safely to the bathroom. Here's the promise of this channel. Everything I say comes directly from published medical guidelines, from urology associations and public health institutes. Not my opinions. The exact sources are linked in the description, so you can check every word. One more thing, and it's important. This is education, not medical advice. I'm a nurse, and I'm not your nurse. Never change a medication or treatment because of a video. Talk to your own doctor first. Deal? Then let's begin. So why does this happen? Especially after 60. The guidelines describe 3 main reasons. Reason 1, your body's nighttime slow down the urine signal gets weaker. When we're young, a hormone tells our kidneys at night, less urine, please. With aging, the guidelines note that day-night rhythm gets blunted, so the kidneys keep producing. Reason 2, the bladder itself may hold a little less than it used to. Smaller tank, more trips. And reason 3, this is the one that surprises people, your legs. During the day, gravity pulls fluid downward, and in many older adults, it collects in the lower legs and ankles. That's why socks leave deeper marks in the evening. Then when you lie down at night, that fluid flows back into your bloodstream, and your kidneys turn it into urine. The guidelines call this peripheral edema, and managing it is an official part of nocturia treatment. The good news, that last one, the leg fluid, can be worked on during the daytime while you're safe and awake. That's exactly what the first 2 guideline steps do. Step 1, put your legs up, is before bedtime, not at bedtime. The Canadian Urological Association's best practice report spells this out. Raise your legs above the level of your heart in the late afternoon or evening for 1 to a few hours before bed. A sofa with firm cushions under your calves works fine. Read, watch TV, your legs are doing the work. Why does this help? The fluid that pooled in your legs returns to your bloodstream hours before bedtime. Your kidneys process it in the evening. You empty your bladder before bed, and there's simply less fluid left to become 3 a.m. urine. The guidelines' own words, these edema treatments will lead to reduction in nighttime voids in most cases. It costs nothing, and it's sitting right there in the official guidance. Yet almost nobody's doctor has time to explain it. One safety note from me as a nurse before you try it: raising your legs sends that pooled fluid back toward your heart. For most people, that's exactly the point. But if you have heart failure, if you get short of breath when you lie flat, or if you have severe circulation problems in your legs, talk to your doctor before starting this routine. With those conditions, that returning fluid can put extra load on the heart, and your care team may want to manage leg swelling a different way. The guideline itself says leg swelling should be treated according to its underlying cause. So let your doctor confirm yours first. Step 2 builds on the same idea. Compression stockings worn during the day. These are snug, knee-length socks that gently squeeze your lower legs so fluid doesn't pool there in the first place. Both the Canadian Urology Guidance and the European Association of Urology's Patient Information recommend them for nighttime urination linked to leg swelling. The European guidance puts it simply: Wearing compression stockings during the day helps stop fluid building up in your legs, fluid that would normally need to be emptied out at night. Now you'll see compression socks on every pharmacy shelf and all over the internet. And here's my honest advice as a nurse. Don't just grab a random pair. The NIH's patient guidance recommends going through your healthcare provider and getting your legs measured at a pharmacy or medical supply store, so the pressure and the size are right for your legs. A well-fitted stocking is firmest at the ankle and eases up the leg. A badly fitted one that digs in, rolls, or wrinkles can do more harm than good. How to use them. On first thing in the morning, the NIH guidance says before you even get out of bed, when your legs are least swollen, smooth out any wrinkles. Off before bed, don't sleep in them unless your doctor says so, and they wear out. Plan to replace them every 3 to 6 months because the compression fades. One safety note from me as a nurse, and this is the standard caution you'll also find on the box. If you have poor circulation in your legs, severe heart failure, or diabetes-related skin or nerve problems, check with your doctor before using compression stockings. For most people, they're very safe. Those conditions just need a professional's okay first. Step 3, look at your dinner table. The urology guidance makes 2 dietary recommendations most people have never heard of. The first is salt. The Canadian Best Practice Report says it plainly. People with high salt intake should reduce their daily sodium to see a beneficial reduction of nocturnal voids. Dietary changes, including normal salt intake, are part of its strong recommendation for initial treatment. Why? Salt makes your body hold on to water, and a lot of the letting go happens at night. Where does the salt hide in an American kitchen? Mostly not in the shaker. It's in canned soups, deli meats, frozen dinners, sauces, and even bread. U.S. dietary guidance recommends staying under about 2,300 milligrams of sodium a day. Most adults are well over. You don't have to be perfect. Read the sodium line, pick the low-sodium version, taste before you salt. And the bonus tip, straight from the same guideline. Consider less protein-heavy dinners in the evening. Reducing evening protein intake is listed right alongside salt in the official recommendations. A big steak at 8 p.m. gives your kidneys extra overnight work. Step 4, timing. The guidelines are specific here, more specific than most people expect. Rule 1, no fluids in the last 2 hours before bed. That's the Canadian guidelines' exact benchmark for nighttime urination. Nothing to drink for 2+ hours before bedtime. Rule 2, think about the whole day. The same guidance recommends keeping total daily fluid to about 2 liters, roughly 8 cups, or cutting your current intake by about a quarter as part of its strong recommendation for initial management. Front-load your fluids. Drink freely in the morning and early afternoon, then taper. Rule 3, caffeine and alcohol earn special mention. The guideline notes caffeine is specifically associated with nighttime urination. It increases urine production and stimulates the bladder itself. The European patient guidance says simply, cut back on caffeine and alcohol, especially in the evening. That relaxing nightcap, it's quietly ordering your 2 a.m. wake-up call. Now that's the caution, and please take this seriously. The National Institute on Aging adds one condition to the drink less before bed advice. Do it only if your healthcare professional suggests it. If you take water pills, diuretics, or you have kidney disease or heart failure, your fluid balance is part of your medical treatment. Don't adjust it on your own. And nobody should dehydrate themselves. The goal is shifting fluids earlier, not drinking less than your body needs. Step 5. If you've done everything and you're still up 3 times a night, listen closely. Do you snore? Loudly? Has anyone said you gasp or stop breathing in your sleep? Here's something remarkable. The urology guideline instructs doctors to ask every patient with nighttime urination about loud snoring and sleep apnea symptoms. It's on the official checklist. Sleep apnea is listed among the recognized causes of producing too much urine at night, and the American Academy of Sleep Medicine's Patient Education names nighttime urination as one of the signs that can point to sleep apnea. In other words, sometimes the bladder is just the messenger. The real problem is you're breathing at night. And the guidelines management pathway for that is sleep evaluation and, if confirmed, treatment such as CPAP. So if the snoring description sounds like you, ask your doctor about a sleep evaluation. Many screenings start with a simple questionnaire, and testing can often be done at home. Treating sleep apnea protects far more than your sleep. And for some people, it's the answer the bladder medications never gave them. 3 quick extras, all from the official guidance. 1. Empty your bladder right before bed, even if you don't feel the urge. The European guidance recommends it. Going to bed with an empty tank simply buys you more hours. 2. If walking or balance is difficult, the same guidance suggests a bedside commode, a toilet chair next to the bed. Less distance in the dark means less fall risk. 3. Make the path safe anyway. The National Institute on Aging recommends nightlights between bedroom and bathroom, a clear floor, and taking a moment to sit on the edge of the bed before standing up. The fall is the real enemy. Never rush. Now the serious part. See your doctor promptly. Don't wait, and don't try to fix it with videos. If you notice any of these: blood in your urine, burning or pain when you urinate, or fever, a sudden change, much more often over just days or weeks, new swelling in your legs along with shortness of breath, constant thirst, drinking large amounts, or unexplained weight loss. The guidelines are clear that nighttime urination can be connected to conditions that deserve real medical attention: heart, kidney, prostate, blood sugar, infection. A video is not the answer to any of them. Your doctor is. Let me leave you with the one tool the guidelines value most. The Canadian report calls the voiding diary, a simple 3-day record of when you drink, when you urinate, and roughly how much. The most important objective diagnostic tool for this problem. 3 days of notes turns "I go a lot" into something your doctor can actually work with. And this week, start with just one guideline step. The easiest? This evening, put your feet up above your heart for an hour. That's it. That's the beginning. Which step will you try first? Tell me in the comments. I read everyone. If plain English guideline explanations are useful to you, subscribing is the best way to see the next one. Take care of yourself and sleep well tonight.